And away from religious stories to our main business of the day. The World Health Organization raised the alarm of coronavirus disease COVID-19 to maximum level with increasing number of cases and deaths recorded globally. Since the confirmation of a case in Lagos, Nigeria, there has been a mad rush for face masks and hand sanitizers as part of preventive measures. Hakeemat Aliyu in this report takes a look at the situation in the Federal Capital Territory.
Since coronavirus disease, or COVID-19, crashed its way into Lagos, Nigeria, through an Italian, the government's relentless effort at dousing tension through sensitization have continued to raise awareness on hand washing and global hygienic best practices. The development, which is creating unease amongst many, has given rise to the scramble for hand sanitizers and face masks as part of preventive measures. With this, it is no surprise pharmacies and stores within Abuja city center have run out of the products.
Currently, we don't have, though we received stock yesterday on the hand sanitizer, but they all finished.
The last one I sold was for about 700. But with the scarcity of it, it went to about 2,000.
I was thinking that they will produce more and make the price cheaper for the least person to afford it.
For now, face masks and hand sanitizers are the latest hotcakes in the market. It is rarely available, and for those who have it, it is on very high cost.
The price very increased, and like now, before they are buying 100 naira. Now you buy it 1,000 naira.
Nigerians seem to take advantage of bad situations. But I think it's a turnaround time for us as a people, really, especially in terms of hygiene, in our homes, in our offices, in everything we do. Really.
Experts, however, have outlined things to note about the disease, which is contracted through liquid droplets from an infected person, against popular belief that it is airborne.
Many thanks, Hakeemat. Meanwhile, coronavirus is now a global pandemic, and Nigeria's government has intensified efforts to prevent the spread of coronavirus after recording cases of the disease in neighboring Ghana. Mariam George-Tubo in this background report examines top-gear efforts to contain the deadly virus.
The Federal Ministry of Health and National Center for Disease Control have moved viciously against COVID-19 since its advent. Its combat readiness to tackle the scourge has proved an effective approach to practical steps in promoting awareness and enhancing safe, healthy practices. Experts say Nigeria is prepared to contain the new virus following a successful response to Ebola more than 5 years ago.
Mostly people that are likely to die from this virus are people that have other conditions like heart disease, like have hypertension, like diabetes, people that are elderly, people that have weak immune system. In fact, most of the deaths occur in people more than 80 years old.
Health authorities in Nigeria are ramping up efforts to detect and contain the coronavirus after Africa's most populous nation confirmed its first case, calling on citizens to avoid panicking or spreading unverified information about the disease.
The churches, the mosque, they should educate their members. Handshaking at this time is not the proper thing to do. There are other ways we can greet. Secondly, we tell our members if they are ill and they have symptoms of upper respiratory infection like cough, catarrh, sneezing, they should stay at home.
Even when you see your neighbor coughing, you quickly turn away from your neighbor because of the virus.
They must be able to have a place now that will be able to serve as an issue, that even though there is case of coronavirus, they should be able to quarantine them there.
Authorities have established testing capacity in 4 laboratories and expanded surveillance to catch up with travelers from countries affected by the infectious disease. The Nigerian Center for Disease Control has also supported the activation of emergency operations centers to serve as coordination platforms, while its coronavirus preparedness group meets daily to review the situation and manage the response efforts.